venipuncture at a 90-degree, you want the arm in your direction. So if you have an assistant stool with an armrest, you put the armrest here, and the patient's got the arm pointed toward the assistant stool. You guys know what I'm talking about, right? So ideally, first things first. Thank you. Okay. The most important thing is set up the tourniquet. Now, the smartest way of setting up tourniquet is you click it, you make a loop outside before you put it on the patient. Once you put it on the patient, you tighten it, you pull on it. Now, this is common mistake number one. Well, common mistake number one is you're trying to do venipuncture on the side. This way, mistake number one, you want to do a venipuncture. You're directly addressing the site. Mistake number two, most common one, is people don't make the tourniquet tight enough. You want it crazy tight. You want it so tight that you can't even put anything underneath it. Okay? All right, next thing, I'll have you make a fist. Mistake number three, very often patients hyperextend. You do not want them to hyperextend. You want them to have a slight kink to the arm so that the veins are not being stretched or flattened out. Okay? Another thing that you want is you want your patient seated as upright as possible. You do not want to do this while your patient's laying down. All right, once you've got all that, I've just disinfected the site. You take your finger and you very gently, you just very lightly run it across the skin. And by doing so, you can actually feel where the blood vessels are. So I can actually feel two main blood vessels, one here, one here. You should be able to see that with the camera. All right? Now, if you really want to make things simple, do you have a pen? Just grab a pen right there. If you really want to make things simple for yourself, initially, do this if you have to. Draw the boundaries of your blood vessel. You see that? That's boundary number one. That's boundary number two. All right? You guys can see that. So I have to pick one. Open up the butterfly needle in front of your patient. Rough side, smooth side, smooth side. You want the rough side on your finger, rough side on your thumb. In doing so, automatically the bevel is up. Leave the sheath on. Okay. Now, with your hand, just do a few dry runs. You're dressing, think of it like an airplane. You're trying to land the airplane on a runway. You want to approach it this way. One hand, apply traction. I don't want you to apply crazy traction. I don't want you to pull to the side. I want you to just put enough traction as if you were holding down an eyelid. Other hand, common mistake. So mistake is people tend to pull to the side. No, you pull it toward you and it's very light, as if you're holding down an eyelid. Next mistake, most people they're going in too shallow. You need to go in steep. If you're going to make a mistake, I would suggest that you err on a steeper angle than a shallower angle. All right? And then the last one, which is very common, two more, is a lot of people hesitate when they poke. You want to be really confident. When Neki says 1, 2, 3, quick poke, it is literally that. 1, 2, 3, quick poke. And you go in, and once you see the flash, again, very common mistake. Many of you will want to hold on to that needle. No. As soon as you see the flash, this is what you do. You let go of this hand, you hold the tubing. Other hand, let go of the needle. That way, the needle will stay in the lumen of the blood vessel. At that point, your assistant will now draw the blood. So that's in that sequence, it's going to happen. So here we go. I've got it. A little bit of traction. Steep angle. 1, 2, 3, quick poke. See the flash? Let go of the needle. Neki puts it in, and it just draws. Now, if you look at this vacuette, it will eventually stop flowing because the vacuum will be lost. Doctor, your job is to hold on to this tubing. Let go of everything else. Okay? Assistant's job is to just draw the blood.
And not to pull on the line.
Yeah, don't pull on the line.
See how I came to
Right.
the tubing instead of pulling it away?
Now, as soon as the assistant's done, they don't wait for me. They go to the centrifuge. While that's happening, I release the tourniquet.
Go.
We run. We go to the centrifuge right away.
Two things. You release the tourniquet. Why? Because this is a garden hose. You want the pressure in the garden hose to drop before you pull the needle out. Does that make sense? Because if you pull a needle out while the garden hose is pressurized, what's going to happen to the blood? It's going to shoot out toward the fascial space, and you're going to cause a bruise. All right? Make a little square. Here you go. Cover it. One swift action. 1, 2, 3. Pull. Put pressure. Make this safe. Doctor, this is your job. This is a bare needle. It is dangerous. You squeeze on either side of the bottom, and you pull until you hear a click. Now it's a safe needle. Now, patient's holding that. Tourniquet's off already. You've got your Band-Aid. You hold on to it. Now, usually, I got it. During this time, as a dentist, I usually want to sit down. I've got my finger on this. I'm talking to the patient. How's the freezing kicking in? Because you freeze before you do this. How's the freezing kicking in? Any plans this weekend? How are you feeling? Oh, good. You're feeling great. All right. By this time, you've held this for probably, 2 minutes? You apply a little bit of traction. Just a little bit of traction. Why? Because that traction compresses the tissue. You can barely see the red dot. Put this over the red dot. Put pressure. Have him put some finger pressure on it, and don't fold the elbow. Because when you fold the elbow, it's no different than you squeezing a garden hose. You want the garden hose not squeezed. Does it make sense? And that's it.